Hi Facebook family, I just thought I'd give you an update on my journey. I know I've only done one video at the moment. This is number 2 and this time I'm using a tripod that my friend Rachel Sanders has sent me, because she said she's not nitpicking or anything, but use the tripod so that I don't get phone wobble when I'm telling my story and talking to people via video. So I've been to Leeds today. Oh, what a journey that was, let me tell you. It wasn't so bad going, but coming back there was loads of delays on the motorways. It was really difficult, and I was racing back. Well, not racing, not breaking any speed limits, let me tell you, because I'm a good girl most of the time. I had to get back because I was having treatment from Clatterbridge. The nurse comes to the house to give me an injection instead of the infusion for the breast cancer that they're trying to control, which is, thank goodness, no evidence of disease of that. It's just this Charlie melanoma that is rampaging through my left leg at the moment. Now, I've been to see Mr. Peach over at Spire in Leeds, and he's talked me through the procedure. To say it's unpleasant, it is quite unpleasant what they're going to be doing, but he's talked me through it, and basically I've actually given an update on the show, so if you listen to the show you'll hear that as well on the show. And they go in through the right side, sort of near your groin area, and feed through catheters, and it's a little bit different to the one I thought I was going to be having. Whereas I thought he was going to do the perfusion, this is an infusion. So it's maybe not quite as aggressive as having your thigh opened up, which is obviously, I don't want really big, deep invasive surgery like that, because I've had so much surgery on my left leg. I've had 10 surgeries on it now. I thought of, maybe going for the baker's dozen on it. It's not funny really, is it? But I do have to make a joke of it. I make a joke of a lot of my journey because it's the only way I can actually cope with everything that's going on. So he's talked me through all that. It will require a week in hospital to have this done, because the leg does get very angry and it gets very upset when it's pumped full of chemicals like that. It is, as I've already said, it will be tourniqueted. My leg will be tourniqueted off. It will be, my leg will be kept very warm, because the treatment works much better when it's warm. And what I'm waiting for now is a date for a pre-op, and then a date to go in and have the procedure done. And he's waiting for scans, which I would have thought he would already have received, but he hasn't. He needs the scans from my consultant in St Helens, one of the many consultants I have, not to be greedy or anything. I've got 3. So I've obviously chased them, and I've rang my skin cancer nurse, and she is making sure that they get over to Mr. Peach's secretary ASAP. So far, that's the update. I'm doing okay. I'm having a lot of wobbles because it's very difficult. It's hard because I live on my own. So it is really difficult, but I have got lots of friends, and I've got all you guys out there who are really rooting for me, which is absolutely amazing. You're keeping me going. I will keep you updated, and all I can say is thank you from the bottom of my heart for all of your support and all your love. It just does make a massive difference, and I keep getting texts and messages off everyone, and that is lovely. Please do keep texting me and messaging me, because it is a really arduous journey, this, and it is a lonely journey. It is hard, but I just want to say thank you so much for everything that you're doing for me. I really do appreciate it. And if there's anybody who's on a journey, like I said in my last video, like this, please do get in touch. We can compare notes, compare battle wounds, just talk to each other, because I do think that people should talk about things like this. They should talk about cancer. And I know it's a really difficult subject for people to talk about, because people don't know what to say to you. Just treat me as normal. If you want to ask me a question, ask me a question. No question is, not going to be answered. If I can answer your question, I will do. Am I scared? Yes, of course I am. Terrified. anybody who's on this journey, it's so uncertain, and for me it's really complicated because of, you know, I've got the breast cancer going on, and you know, I've got melanoma going on, so it's really difficult to try and treat it all. And because, you know, of the staging of both cancers, it is hard. But keep messaging me and keep sending me your texts, because I really do appreciate them. Thank you so much for everything that you're doing for me. Take care.